My name is Lindsay Stroud. I'm an assistant professor of dermatology at Wake Forest University School of Medicine, and I'm accompanied today by Dr. Jessica Savas and Dr. Christine Ahn. And today we're going to demonstrate how to properly use wet wrap therapy. So first of all, wet wrap therapy has been used for many years, mostly in the inpatient setting, to help patients that have very widespread cutaneous disease, and it is an effective method to get very rapid improvement in the skin. You only need a few supplies to get started with wet wrap therapy. So today we're going to be using several towels. You'll need anywhere between 8 and 12 towels depending on the body surface area of the patient, as well as a large supply of a mid-potent topical corticosteroid such as triamcinolone. Ideally, if you can get a 1-pound jar, that'll be enough for this application. And then we'll also be using a tub of very warm water. So you don't want it to be too cool because we use heat as part of the therapy in the wet wraps, but you also want to make sure it's not too hot so as to not burn the patient. So we're going to go ahead and get started. The first thing that you're going to do is expose the arms and legs of the patient. Then we're going to take the mid-potent topical corticosteroid and apply liberal amounts to all of the exposed areas of the skin. You really want to use an adequate amount of the topical medication. A thick layer is going to do better. The medicine does not have to be rubbed all the way in. And we'll repeat the same process on the patient's upper extremities. Next, what we'll do is soak some of the towels in the warm water. Once you submerge them in the water, you'll want to wring them out. You want the towels to be wet, but you don't want them to be dripping wet. So you'll unwrap the towel, and then you'll immediately place it on the area that you just applied the medication. You're going to want to be sure and apply the medication to both the top and the bottom surfaces of the extremities. Once the patient's skin is covered with the warm, wet towels, then you'll use dry towels and wrap the patient's legs and arms a second time. Wet wrap therapy is effective for several reasons. First of all, applying a liberal amount of the topical medicine and then applying occlusion over top of the medication allows for better penetration of the medication to the top layers of the skin. It's also helpful because the moisture helps lock in moisture to the skin and prevent evaporation of the medication. The heat from the warm, moist towels helps dilate the blood vessels in the surface of the skin, which also helps enhance penetration of the medication. And furthermore, it's comfortable for the patient, especially when they're covered in a very itchy and sometimes painful rash. If the patient's trunk is also involved, you would do the same process on the patient's front and also on the back. Once a patient has been fully wrapped, we typically recommend leaving them in this state for 1 hour and then removing both the dry and the wet towels. This can be completed in an inpatient setting twice a day and can lead to really rapid improvement in a patient's skin within as short a time as 24 to 48 hours.